Welcome back to Your Dialysis Nurse. If you haven't had the chance, please follow me on TikTok. And if you enjoy my content, please subscribe to my YouTube channel. Today, we will start on PD Basics Part 6, which is all about PET tests. Let's discuss what a PET test is and what it means in PD. What is a PET test? A PET test in PD measures how well a patient peritoneal membrane removes waste and water. Remember, PD uses the lining of your belly to perform dialysis. The test usually takes 4 hours and requires you to test drained effluent samples at a certain time and get a blood sample at a certain time as well. This test will check how much glucose and creatinine is present. The transport character not only helps to decide the dwell time, but also plays a crucial role in determining the morbidity and mortality of the patients on PD. Here are the times to keep in mind during a PET test. These are the times that you will collect samples of the dwell. Keep in mind, the patient should arrive already dwelling with 2.5% solution in them for at least 8 hours. This is called the overnight dwell. Here's a chart to simplify things. To keep it simple, we will leave it at 3 types, which is high, average, and low. It can get a little more complicated when discussing high average and low average. A patient with a high transport membrane means that the solution will flow through their membrane fast, which means that the patient will reach a state of equilibrium faster. Ultrafiltration and diffusion is achieved in a shorter period of time. Thus, shorter dwell times are encouraged for patients with this type of membrane. An average transporter membrane can usually do both types of PD modalities. On a machine, also known as APD, or manually by gravity, which is known as CAPD. A patient with a low transport membrane needs a lot of dwell time because it takes a long time for solutes to cross over for a good UF to occur. So it is preferred that they do CAPD, which allows them to dwell for a long time and space out the exchanges. However, it is not ideal for patients to do CAPD because you don't have a machine doing exchanges for you. And most patients want it to be done at night so that their days are free to work or run errands. When and how often are the PET tests completed? Depending on your company policy and procedures, PET tests are usually completed within the first 6 months of the patient starting dialysis. PET tests are usually done one time unless the patient gets an infection, also known as peritonitis. If a patient has peritonitis, you will have to follow your company policy and procedure on when to complete another PET test. Why would another PET test need to be completed? Usually, you would complete another PET test because peritonitis may cause damage to the peritoneal membrane. If this occurs, it can make a patient a different transport type, thus making the current prescription inefficient. Thank you again for stopping by Your Dialysis Nurse. If you enjoyed this video or any of my other videos, please like and subscribe to the channel to get notified every time I release another video. Blessings, Your Dialysis Nurse.